All right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, what's on the agenda for today, Heather?
So this one's a little bit different. The woman we're bringing on, she doesn't necessarily represent a specific app or a tech or a device or a whatever. What do we call
It
it?
doesn't have a specific product
A
or anything.
widget.
There you go, a widget.
Michelle Frank is her name. She's a clinical consultant for healthcare startups in the women's health space because
A general women's health guru type.
she is. Yeah, she's worked for a number of for healthcare tech startups. Hashtag Femtech. And just has kind of a more global perspective, both from being a doctor and then also just kind of being in this tech startup world where so many people that come on our show do represent those widgets, which, is kind of fun to be able to like name drop a little bit. And
Right.
she knows all those people and that they've been on our show, which means that we're becoming a wonderful platform for women's health. So,
We really
um,
are.
yeah, so Michelle just provides a kind of just a different, more global perspective to the whole thing, and that there is a lot of help out there for women, and so really, really interesting conversation.
Yeah, yeah,
So,
yeah, cool. So, without further ado, here's our conversation with Michelle Frank, Femtech consultant.
hi, and welcome to the Healthcare Uprising podcast. Today we have with us Michelle Frank, who is in Dusseldorf, Germany. We're going global. Um, Michelle is I would say you are expert in the women's healthcare space. We'll leave it
Right.
at that. Yeah, and let
Okay.
you kind of dig
Yes,
into
that's
this. But
perfect.
welcome. We're glad to have you with us today.
Likewise, thanks for inviting me. This is a very, I think, different kind of podcast I'm going to be on. Most of it is either professional or what I have done. This is a mix of both. So I'm really excited to be here and have this conversation with you.
Yeah, we are too. And I was telling Jeremy how we got connected, the power of LinkedIn, and
Yeah,
being in kind of the women's health kind of femtech circle
right.
that I have been kind of loosely adopted into since starting this
Hmm.
podcast. And I think you put a post up on LinkedIn, the algorithms showed it
Yes,
to me, and I thought, oh my gosh, you'd be so great because we cover so much in women's
right.
health. So we made it happen.
Cool.
We made it
All right.
happen. Yes.
Yeah. So with that, Michelle, why don't you just give us just kind of some, background, like what's your story? How did you get to be involved in the women's health space? And we'll go from there.
Perfect. So we will shortly dive into how I got here, but over the years, I think women's health has become a passion for me. It's something I'm interested to do every single day. It's not something I imagined I'd be doing all these years later. And I've worked in many different spaces, tech, content, community, and a whole mix of the things over the years. So I think I wouldn't pin myself down to any one professional criteria, but I would say that most of my work involves talking to women. And I think that's my favorite part of the work that I do every day, to find out what women want for their health, to be able to, in some way or my own way, help bridge the access for women and their health, and also to be able to translate a lot of medical knowledge and medical jargon for women. I think that's something I say I'm an expert in more than anything, because I've realized that even if you're a doctor, you may not know how to talk to women about their health because we are taught in a very different way. So I would call myself an expert more in that, in having conversations with women and figuring out how women really want to talk about their health. I think that's where we connected on LinkedIn, because
Hmm.
that's something I do now every day, because I realized that uh, I love talking to women. And if I'm able to, in some way, help somebody every day, I think that's the least I can do professionally, I would say.
Yeah. You're like a great
Yeah.
translator of women's health, right? From like the
Yeah.
clinical to the kind of tell it to me, what is that saying? Explain it to me
Yes.
like I'm a 2-year-old, right?
Yes. Yes.
Yeah.
I would
Love
say
it.
the same thing. I still say it that way. I said, if you
Yeah.
cannot understand it yourself, then you're not saying it right.
Yeah, plain
Yeah.
language in healthcare is really important, and I think that it's
Yeah.
probably something that you and I have a lot of me as being in marketing communications, being a writer in healthcare. That's like
Mm-hmm.
been one of my goals is taking all that very clinical information, putting it into a way that like the patient or the plan
Right.
member, here in the States for health plan members,
Right.
understand, right? So that they can do something with it or make sense of
Yes.
whatever their problem is. Yeah.
Yeah.
Great. And you fell into the startup space, right? So, but
Yes.
you were in internal medicine. Can you share a little bit about how you've made that transition from becoming a doctor and then showing up here in the
In,
tech space?
internal medicine. So you were a real like doctor.
Yeah. Yes, doctor. So initially, I was on that path to being a doctor. But
Mhm.
when I joined my first startup, that's when I realized that I actually love doing this. It's even though I talk to women today, it was one of the first jobs I had was answering questions that mothers had about their babies. That was
Mm,
pretty much my day in and out every day. And I realized at that point that these are conversations that are not happening every single day because I was working in India, and that's a country where doctor has pretty much a few minutes for every patient. We don't really have time to have conversations with the women, or we don't have time to really dig deep into what is concerning them. So there's so much miscommunication and so much gap from what she's trying to say and what she really needs, that the woman herself is so confused by the time she leaves. So I think that's when I realized that, okay, this is what I really enjoy doing, because when you sit in a startup space, you're behind a screen and you're trying to have these conversations where it's more detailed and it's more cataloged and it's more understood. And that's I think what made me stick to it. And
mm,
over the years, it's something that has made me feel that, okay, I am actually providing value in a space that has been unknown for so long. And that's almost 10 years ago. It's now
mm.
it's the discussions have evolved, and the way women are approaching their health conversations have also evolved. But it's that aha moment you have at the time when you're having that conversation and you realize, okay, this is something that needs to be done. And maybe it's just me doing it right now, but there are many doing it all across India. And then you
Hmm.
network and you reach out and you find more people doing it in the space, and then you build it into larger what it is today, I'd say globally, not just in India.
Yeah, just like you and I meeting. So, yeah.
So
Yes, yes.
what's your application and format here? Like, how do you actually interact with these women? Are you talking to patients directly, or are you putting out pamphlets kind of thing? Like what's your actual
Okay.
process?
So over the years, I've worked in, I'd say four different startups.
All women's
So
health?
all women's health, different
Okay.
aspects of women's health. Some
Hmm.
are, as I said, it was a parenting app. Then I worked in a pregnancy app. One
Hmm.
was a women's health community, basically. So women asked questions like menstrual health questions or menopause or fertility questions. So it's different aspects of women's health.
Hmm.
So when the company builds an app, they essentially build a Q&A forum, or they build a community, or it can be an external community as well. Like now we have WhatsApp, Facebook, etc., where communities get built. So women come there, especially in India. I realize it's pretty popular because WhatsApp is very easy to network in India. So women tend to
Hmm.
be on a WhatsApp, and this is easily integrated into any, if it's a startup forum, or if someone is building a product, they probably would start with the community. So I realized that
Like
a
a
lot of
group out there. I haven't
yes,
actually used WhatsApp that much, to be honest with you. So,
it's not as common in the US, I realized, because I lived in
right.
the
I
US for
know.
a year. So that's
Yep.
what I know. I realized it's not as common, but I realized in Europe and in India, it's pretty common. A lot of
Okay.
It's
women
pretty
use WhatsApp here.
pretty
But
much the
Facebook,
whole rest of the world for
Okay.
sure.
Everyone but
yes.
us.
Everyone but America uses it because
Gotcha.
even
Yeah,
my
I
I have a
guess.
lot of relatives in Mexico, and our family, my mom's family's group chat,
It's all in
because a
WhatsApp.
couple of her siblings now live in Mexico. It's all on WhatsApp because that's what you use in
So
Mexico.
that's a pretty typical
It's
platform
it's it's a everyone but America uses it.
for
For
community.
it's basically yeah, like the chat room, like what we you do on Facebook groups,
Gotcha.
things like
So
that.
it's a kind of
Like
equivalent.
private chats. It's like a Slack slash Facebook
Oh, okay.
groups. Yeah.
Yeah,
More
Slack, I guess, would be more professional. So it's
gotcha.
not
I use
really.
Slack every day. Yeah.
I
Yes,
use
Okay.
Slack. Slack is a big one here.
me
And
Thank you
too.
for that
So yeah,
context.
yes.
Okay.
But it's not only WhatsApp. It's so if they build an app, a feature of the app would be a community. So I
Sure.
think that is something I have worked with more closely than I think the WhatsApp has picked up lately because it's
Hmm.
easier to integrate. But
Hmm.
initially, it was a community within the app or the platform that is being built. It could be on a website as well.
Gotcha.
So yeah, so women would collect there or through referrals, they would come there, and it would be a specific condition or specific area of their health they talk about. So it would be women about postpartum or women going through pregnancy or new mothers or all women asking in menopause. So it's not specific like all women of all ages. So it's very specific to what age, and those would be the women that come to this community, ask questions about them, their health. Um, More than me just answering the questions, I think it would be moderating the conversations. What should women be talking about? What are women not talking about? How do we get women to talk about that? So I think it's a very experimental thing. It's not that you know what you're going to get from day one to day two. You have to go in there and see what they ask, what they want to know about. Women from different places want to know different things. So it's really figuring out how to navigate these conversations every day.
So you're really showing up with these different apps, these
Mhm.
different startups in this kind of clinical kind of consulting type of role. Would that be a way to categorize it,
Yes.
or is that okay?
Yeah,
Got it.
more clinical because of my background. Yes, I
Hmm.
will also be a part of the regular conversations. But if a woman has a health concern, I could be more of a voice that it's Dr. Michelle, so she knows what she's saying,
Hmm.
right? So a woman can trust that. It's not really about, I think that trust factor is very important.
Hmm.
So, because a lot of misinformation is very easily spread in these spaces. So, I think
Mm.
having someone from a clinical background is very important. I think that's also another thing from one of your previous questions. It's so important to have more of us in these spaces because you can help to moderate the conversations that are happening within these
Hmm.
spaces.
That stop any misinformation, clarify
Yeah,
anything that might be not super
right.
clear or potentially confusing.
yeah, just
Yes.
help and educate people about their own situation is always a very helpful thing. Yeah.
Yeah.
Yes.
Yeah. That's so okay. So you're in these kind of clinical kind of consulting type of roles. You're in these chat rooms, essentially, you're moderating. Um, like what happens with the startups when you're involved kind of on the ground floor and then you kind of get them to a good place, and is it kind of like building it and then being like, all right, my work is done here. I've done all the
Oh,
magic and then you move on, or do you concurrently
that's
work
an
with different
interesting
startups?
question. Oh, that's a
Yeah.
very interesting question. So I think it's an evolution, I think so. Like my first startup got acquired by a larger startup because we had a more robust tech team, and even the way we were building our community was more robust. So that was something that I guess appealed to the startup that acquired us. So so when I joined them, it was pretty much building their women's health community from ground up because it was almost a few thousand women to several thousand women over a couple of years. So I think it's not really me deciding, it's me transitioning from one role to the next. And then after a few years of evolving us in the community or the startup, you then decide, okay, maybe I want to move on to something new, or you get approached by someone else. Okay, maybe I can
Right.
help them build. So I've really seen me working in a 0 to 1 situation for
Hmm.
most of the startups that I've worked with, where they're just building or just starting out because I also get to figure out, and you at this stage it's like use my experience on what has worked, what hasn't worked, and what could work for building from the ground up. And today I'm able to work with, since we have women's health, different spectrums of women's health startups out there. So I can consult with more than one, like maybe working with only menstrual cycles to menopause to pregnancy and postpartum. So I get to work on a little bit of everything versus just picking one or two. So I
Gotcha.
think I really enjoy that. And since I work remotely, I work globally as well. So I
Hmm.
think that's even more interesting for me.
And you
Yeah.
can kind of be everywhere at once. That's pretty cool.
Well,
Yep.
and I imagine too, being in now four different startups and probably I'm guessing you probably have your hands in different things. You're in the space all the time. Obviously the
Right.
posts that you put up on your LinkedIn page, very, very meaningful, good, informative stuff. Um, so you're seeing this kind of part of healthcare being built, really. I mean, you're part
Yes.
of it, right? And we get to
Yes.
connect with each other like this and this, in this platform. I'm a huge supporter of women's health. I'm not building apps by any means. I'm not one of those people, but we're all part of it, right? Like we're all kind of like
Yes.
intertwined.
We
What do you,
we promote the apps that they're building.
true. We do
And
promote
Is what we do.
yes,
important
we we
important
do that.
facets I would add, like every one of us are important in
Yeah,
the ecosystem.
absolutely. Yes, we
Yeah.
all have a place, and there's so
Yeah.
much opportunity right now.
Right.
It's there's, and so that's what I'm kind of getting at is what are you seeing now? Having been in this space for 10 years, we're seeing a
Mm.
huge rise in just the attention on women's health, the building of so many apps and devices and things, thanks to AI, honestly, and just, tech. What what's happening? What are your feelings on that? Like what do you think's changing? Because this podcast is for normal people, right? Like, and so
Right.
our goal is always to tell them this is what you guys need to care about because this is for you at the end of the
Mhm.
day. So,
Right. So I think for me, the most exciting thing right now is we have moved to a place where we can actually see the difference.
mhm,
Initially it was just starting out, is anything going to happen? Are we building towards something that can actually bring about change? But today we have so many, we have something like a podcast discussing women's health, which was unthinkable at a certain point. So
mhm,
I think today we are at a space where we can actually see a change happening where it's tangible in on all spaces of women's health. It's not that you only, okay, if I have only pain, menstrual pain, I'll get some help. But it's like in all aspects of women's health that is being prioritized. And I think that's the most exciting thing about what's happening now. It's not that you need to only be in a certain phase or maybe certain aspect of women's health. It's more all encompassing, and you can be anybody asking for help from anywhere in the world, like even if you're in rural India, for instance, or in
mhm,
Africa, like something as simple as a phone can connect you to a hospital or give you access to a doctor. So I think those are kind of exciting times, while we still have more wearables, etc. Those are more top tier health innovations, but we have simpler things that are actually making differences, like remote ultrasounds being taken place and robotic, even diagnostics in mammograms, etc. So those are
mhm.
like AI and checking breast cancer, and also those are more life changing things that are happening right now.
Oh
And
yeah.
yeah, so I
I,
think those are the
I'm
more
thinking of a
exciting.
few that have come on our show, like Strawberry Health with the blood test.
Oh
We've got
yes, they are doing great work as
we need
well.
to bring her
Yeah,
back actually
That was
because
a
yeah.
while. That was
they
like
were
episode two.
they were one of our first
There were
shows when we
two.
launched.
Oh, they
Yeah.
are doing great work. Yeah.
So
So
great.
yeah,
So,
so there
yeah.
are so many of them in so many different aspects. Something as simple as getting a speculum. The speculum has been reinvented to cause less
Yes.
pain. Exactly. So it is
Ugh.
aspects of health that have
That's
been
like
neglected for
traumatizing when you
exactly
think about the
aspects
Jeremy's
of
like,
health that
what?
have been
Even I can like I look at one of those and I'm like, ugh.
Yeah, it feels very like archaic from like the
It
1800s. And
looks
we're
like a
like,
medieval torture device of
yeah,
some kind, is what it
can,
looks like.
it
yeah, can we
somehow
please?
was and has been all this while. Yes. So it's
Uh,
great that these smaller things which have been neglected for so long are actually being
hmm
showcased and like being talked about. Okay, this is not so great. We need to have it changed, and change is possible. So I think that's the most exciting thing that's currently happening. That everything that is possibly being going wrong, or a woman has been talking about it for years and years and years and not had anything done about it, is actually being done now.
Yeah. I was going to comment because I want to ask about like differences in culture. So you're in Germany, you're from India, you've been working kind of over in those
Hmm.
regions,
And working basically globally, right?
but also working
Yes.
globally. And you mentioned the lack of time that women have with their doctors in India. And well, I was happy and also sad to know that we have the same problem. It's not just a US problem, right? It's not just an American problem, it's an everywhere problem, it
Hmm.
seems. which I honestly wasn't, I didn't know that, right? But what are like, do you see a lot of differences, whether it's cultural, whether it's how far tech is coming, where I think it's like big, big, big stuff here in America, but
Mm-hmm.
maybe the tech in like European countries, India, or maybe a little farther behind, but then there's like this resurgence or whatever going on in like Berlin and also India right now around tech. So I want to kind of talk about that a little bit and what you're seeing.
So I think tech is progressing universally, as we all know, at a
Hmm.
very fast pace. I don't know if all of it is including everybody, that I cannot say 100% because some are still being left behind. There's
Hmm.
a lot of discrepancies, even with AI and algorithms and the LLMs, etc. So there's a lot of people getting left behind, not being represented. But I would say that the concerns or the issues are global or universal. If a woman somewhere is struggling with something, it's more likely it's happening in Europe or in US or anywhere else. It's just that maybe she's going to take longer in India to get recognized for it because there are billions of women there who
Mm.
need to get to it first. So I think it's just a numbers game, and when is it going to happen first somewhere else before it happens in some other country. So it's
Mm.
really about nailing down how do we reach a larger group of people, how do we prioritize concerns for everybody, how, since we have technology now, how can we shorten processes that are taking away the time of the doctors with the patients that actually need to be prioritized versus so much of paperwork, et cetera, which is wasting the time. And I don't know, women are getting lost in the system because of it. So I think it's more figuring out how to prioritize the important parts of healthcare versus just going at it blindly. I think so. So it's more understanding it. And that's where talking to women more comes in. Like you have to talk to the women to figure out what is missing for them. And I think that's what would be the most biggest difference in different countries, is that women in India would want something else prioritized versus a woman in, say, Germany or in the US. So what are the women asking for in your region? And that's the only way you're going to figure that out, is by talking to the women over there. Because that's the biggest difference I have noticed in different places, is just what they're asking for. Because some might be a little behind, some might be a little ahead. So you cannot skip the whole process and get ahead in line, so you need
Hmm.
to build a system that is more conducive to all aspects of the healthcare, not just, okay, she has reached here, only we have to fix this much and forget everything else. Because she'll come back again, you have not really figured out the whole thing.
Yeah,
So
we're definitely
I
not the
yeah,
same, right?
Yeah.
exactly, we are not the same. So I think
Not even
it's more
close.
talking to the woman and figuring out exactly what she needs. Yes, the system can look similar, but you need to tailor it to any possibility, right? So
Yeah,
being just categorizing her, okay, she's only this much or she's only that much, is
yeah.
unfair, and
There's
it's
so many
gonna cost.
nuances. Yeah, I mean,
Exactly.
even urban versus rural, right?
Yes.
Your needs are going to change. I would even say, and I can't speak on the behalf of where you are, but like in the US, certain, we'll call it kind of social ideologies, or even in some cases, laws
Mm-hmm.
um, that are around women's health issues, which I am not going to go down that rabbit hole. Jeremy's like, uh-oh.
I'm ready. Yep.
He's like, I'm ready. But here in the United States anyway, like depending on what state you're in, there's
Mm-hmm.
certain things, issues,
Yeah,
hurdles, etc., that
I
you might
know.
have to deal
Mm-hmm.
with that you're like, I know.
Yeah, I know.
But so that can change the way that you access healthcare. That may change the way that you think about it. So yeah,
Yeah,
definitely
it's
a lot of
strange
nuance.
Yeah.
because you have to go somewhere else to get healthcare that you should be able to get at home.
You should.
So it's something as simple as that
Hmm.
needs to be reevaluated. And the only way you're going to know is by listening. And it's not that the women are not saying anything.
Oh yeah.
Wherever some things, yeah, they are saying, and they're talking
we're
about it
we're pretty
really
loud.
loudly. Yes, really loudly. So it's a matter of fact of listening to them and understanding that if a woman's talking about it, she needs to have the priority on what she needs to do for her health and not someone else from the
Yeah.
outside.
Yeah.
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 Oh, Jeremy, did you want to say something?
No. Well,
Oh,
I mean,
yeah.
yeah, but that's a different
I
conversation.
mean, yeah, but
Yes.
it's interesting. I do love seeing the just women's health in general becoming so much more front and center, and especially in
Hmm.
the tech space. And again, it's kind of like my little echo chamber that I'm in. But what I've been hearing, even from like the most recent big conference, health that
Hmm.
just happened, I was seeing a lot of posts on LinkedIn from many women who've come on the show that had said women's health wasn't a sidebar conversation, it was the conversation, which
Yes.
I think is incredibly exciting. Like what kind of changes are you seeing from your perspective? Are you seeing like growth in certain areas, or is there like still opportunity um, in other areas that
Hmm.
maybe you're starting to see
I
from your
think
perspective?
it's a bit of both.
Hmm.
There's definitely growth, and as I've mentioned earlier in our conversation, that we've actually come quite a long way ahead. Because I don't think that we would be having the discussions we're having today if we haven't progressed at all. So it's definitely we have come a long way. There's tons of growth happening. There's so much of exciting things being developed for women's health, but in saying all of that, there's always opportunity, because we need to understand what we don't want to keep innovating and fixing things always. We need to have a system that's pretty much fixed, so that women can access health the way it is. They don't need to always, oh my God, this is not there. What do I do? And where do I go? So that's when we know we've actually grown enough or grown
Hmm.
closer to having a system that works. So I think there's always opportunity if a person is still talking about what the lacks or the inefficiencies in the system. So that's what we need to listen to, I think, closely, to grow and scale and maybe make the system working for everybody and not just a few people.
Yeah,
That's a nice thought.
isn't it though?
Yeah.
Yeah. I mean, it's funny. I feel like, at least with this show, the healthcare uprising, right? Like
Hmm.
it's an uprising. We're here to showcase, people who are these innovation, right?
Right.
In the healthcare space. And so much of the show has been in women's health because that's where and I'm feeling we're like practically like a women's health podcast at this point. Sorry, Jeremy. I know that's not what you signed up for, but
Oh
Um,
no, the menopause man suit is in process.
yes, yes, he's gonna be our
I'm
official.
here for it.
Yeah, he's gonna be official menopause man. We're creating a character. It's a whole thing,
That's
Michelle.
interesting. Yeah, I'm looking forward to it.
I had no idea what I was getting into, but I will take on any male in America, including the doctors, on a Jeopardy style menopause themed
He's learned a lot.
trivia show, and
Yeah,
I will
you've
win.
definitely learned a lot. Yeah.
I really think I know more about menopause than any other man in America at this point because of this podcast.
But yeah, there's just so much innovation
Hmm.
um in this space, like awesome, right? Like as it
Yes.
should be, because we are complex creatures,
Hmm.
and we have lots of needs. And and there's so many people that are solving for different things. Like I mentioned, strawberry health, right? That's a
Right.
blood test. I was thinking of timeless biotech with the menotime. Um,
Hmm.
that's hugely important. We've had other people come on who are solving for around pregnancy or post pregnancy or mental health. I mean, the list goes on.
Endometriosis.
Endometrio, I still
Endometriosis.
can't
Endometriosis.
say that word. We're just gonna say endo. And it's mind blowing. But I think that where the struggle is, and you working in this space, is that there's so many people that don't know about it, right? Because
Yes,
you've got
absolutely.
so many little companies.
Absolutely.
How can we change that? What do you think is a good way to kind of get that information out there?
So
Hmm.
there's no one way. There's
Yeah, that's a
absolutely
big
no
question.
one
It's a
way.
big
Yeah,
question.
it's a big
Yeah.
question, because how people approach information is also different everywhere. It's
Mhm.
not the same every single place. So, in the good thing is now we have social media everywhere, and it's very easily accessible and used very heavily in all countries. So, I think sending messaging that way, I've seen it actually work in India quite extensively. We have quite a few professionals that are actually talking about women's health quite openly.
Hmm.
So that's a great channel through which we can explore further. It is also by getting yourself out there and talking more to the women, especially people like me working in the space, having these conversations. I know we have a lot of conversations amongst ourselves because we need to have that, and because that's where the innovations are taking place, that's where the new discoveries are taking place, research data, etc. But it is also looking on the outside to the women you actually want to help. So I think trying to go talk to more women, understand what their concerns are, maybe take trips to your the local villages that you live or nearby where you stay. I think those are simple ways to create awareness more, understand how it's working beyond just what you are aware of, you know. So
Hmm.
like going outside is the best way. It's something I have done and enjoyed doing over the years, is because we don't really know how much the women know unless we talk to them.
Oh my gosh.
So
Yeah.
yeah, we
Yep.
don't
It
know that.
amazes me how much people don't know that's out there, which is like the purpose of what we're trying to do, right? We're trying to
Yeah.
like it, you don't just have to use your insurance, right? Like
Yes.
insurance is becoming a backdrop where it used to be the thing that dictated how you
Yes.
got care, who told you what, how decisions were made. It's like we're getting this control that we never had
Hmm.
before, thanks to these apps, thanks to these medical devices and things like that that are being sent to our homes.
Hmm.
These community groups, like what you talked about, like just creating those conversations online, getting
Yes.
women, because women love connection, right? We love community. We just
Yes.
are
Yes.
naturally drawn to it. So it's like the more we can create those conversations, like the more you'll know, right? And
Yes.
yeah,
It's
so
something I actually said last week. I said women thrive in communities because that's,
yes.
you don't even need, I mean, yes, I work in women's health, but you can have something as simple as in India, we have this thing called kitty parties where women just meet every week to play a game of cards and talk about their children probably and something like that. It's very common
I
and it's
didn't
been
know there was a
happening for
name for it.
years.
That's me hanging out with my girlfriends every week.
In India, it's called, yeah. So that's what I'm
I'm gonna
saying. It
start
still
calling it that.
happens. It
Yeah.
happens all the time.
I
So
love
it's not,
that.
yes, it happens all the time. So it's a very natural situation to find women with each other. So to
Hmm.
have communities online which allows them to talk more openly about their health is only a natural next step to seeing and understanding more conversations about it. So I think that's
Yeah.
encouraging more of that. Having more specific communities also important because women should not feel lost in
Hmm.
certain spaces. So to have more specific communities for these conversations, and also more regional, because working in India, I realized language is a huge barrier. So even in countries in Europe, I wouldn't say all women understand English. So like if you're building in a certain area, you need to consider the regional aspects of
Okay.
how conversations are going to take place, how they're going to evolve. Don't assume what you're building everyone's going to understand. So I think these are some simple things that you need to consider before putting it out there into the world, I
That's
guess.
interesting.
Yeah.
Yeah.
Yeah, culture has a lot to do with how people approach their health, right?
Hmm.
Yes.
Like the different issues they're gonna focus on and just the different diets that they eat and the different
Mm-hmm.
lifestyles. I mean, it can have such an effect that
Yeah, I
Yes.
feel like
you
that
really
came up.
have to, when you go global like that, I imagine, yeah, you got to
Mhm.
really kind of adjust to every given situation.
Was it
Yeah.
Cybele Health? There was, or another one. We've had so many that came on that nutrition. I think we've covered it a few times.
We've had a few different
Mm-hmm.
nutrition ones, yeah.
Nutrition based on cultural differences and things like that. And then even I'm even reflecting back to a recent interview. It's not published yet, on indigenous doctors, for
Oh, okay.
Native
Mm-hmm.
Americans, where they can't work on, like, they need to have like healing ceremonies before they work on cadavers as part of their
Just,
clinical training, and like
yeah.
just even things like that. That's not even like the patient, right? That's not even,
Right.
that's just
Very interesting. Yeah.
right.
Very
That
interesting. Yeah.
episode, by the
Very
way, comes
interesting.
out today.
Oh, that's right. It
Yeah,
does
so
come out.
by the time this comes out, that episode will be out.
Yeah. but
That's great.
the cultural
Yeah,
differences.
I
Yeah,
find that
that's
very interesting because a lot of
mhm.
that happens in India. You go to
Oh.
different paths, and yeah, yes. So a very interesting thing that used to happen when I first started working, which I didn't even know, was a lot of moms would ask for home remedies for a lot of things. Like, what can I do at home?
Mhm.
Or what other things I can use in my kitchen cabinet to help my baby. So that's a very common, and then I realized it like this conversation transitioned to many other conversations, such as abortion, or how do I find out I'm pregnant with some things in my, again, with my kitchen cabinet. So I was startled, like, how is this happening? But I realized that it was a very common conversation women had amongst themselves, and it should not be happening ideally, because you don't want a woman to try something that could cause further harm to her health than actually help her out. So that's when I
Yeah.
realized, okay, we need to be talking about this more. Why is she resorting to this, so to
Mhm.
question that line of questioning, to understand why has a woman reached this decision, is so important.
Yeah. I'm thinking too, some of the just kind of in the grander,
Hmm.
I don't know, conversation around women's health and maybe just healthcare in general. Again, some of
Right.
these cultural differences, like in the United States, where we often do go back to what's your insurance? Do you have insurance through your employer? Are
Hmm.
you on Medicaid? Are you on Medicare? Do you get your plans through the ACA? ACA is all over the news right now. That's a
Right.
huge, huge, huge plan or program. It's
Hmm.
extremely critical. But then you go to other countries and they have social, what we call what social healthcare, right? Like you're paying
Right.
into the system, where it's like government funded. How do you see that kind of, how does that, like, what role does that play from your perspective, where maybe you've encountered that either in India or Germany or even
India, yeah.
other countries for that matter?
Yes, I think the insurance system and how public health plays out, a good example was our COVID time. I
Hmm.
think that time we learned the most as to the insufficiencies of our healthcare system around the world. But I think it's a very tricky situation because a lot of people in India can get treatment free, but they're unaware of it because we have some great facilities available. They can go and get their treatments done, a lot of it free, but either they're unaware, the access is not easily available, they live really far away and they cannot get to a public this thing. Another thing I realized is the stigma that is surrounded by going for something like this. Like a woman going to get any kind of treatment is usually like questioned a lot. Why do you want to go for this? Why are you having this? Do you have, like, she can't even go for something like contraception very openly to talk about
Mm,
it. So I think there is a many different areas to consider when we think, okay, yes, she may have insurance, she may be able to get something, but will she be able to get the care once she reaches there? So
mhm,
what are the struggles she's going to face once she reaches there? So something could be free and she may still not go to get it because, oh, will my doctor tell someone in my family I came to get this? So I think it's a really very confusing problem to have, a little bit. Like, you may have the healthcare accessible but not be able to access it, and then the insurances themselves cause a lot of problems because you don't know which one to get, which one to take,
mhm,
what you're going to get once you reach there. So I think something that's simpler and something that everyone can use, access, and understand. I think the understanding part is so important because a lot of people have insurance or don't have insurance for multiple reasons because, oh, I don't know why I should get this. Am I ever going to get sick? Am I ever going to use this? That's a lot of things that happen in India. I have many people I know who think in that way, that I won't
mhm.
get insurance because nothing's going to happen to me. And then there
Yeah.
are those who have insurance and never use it. Like, oh, we
Hmm.
don't need to, until something serious happens to me, I don't need to go and get anything done.
Yep.
So the
I've said
spectrum of
that.
the,
Oh,
the
they've
spectrum of
had,
the
there's a
problem is
social
different.
stigma
Yeah.
in America that if you actually use your health insurance, you're being a bad citizen.
It's
Oh,
This is
wow.
health
Yeah,
insurance that you pay for. It's
yeah.
not supplied
exactly.
by the government here. You pay for it. and there's still this weird stigma where like you shouldn't even like, I mean, a lot of people I know, it's like just going to the doctors like, oh, what are you, some kind of weakling? It's like, no, I'm
Yeah,
sick.
that
Yeah.
happens to women a lot
Like,
because
Mhm.
they get worried that someone's going to talk about what they have, you know.
oh yeah,
So
me too.
because the doctors usually when they go to family doctors or something, they are known well in the network. So they get worried to go and discuss any intimate or
Mhm.
gynecological concern because what if my doctor tells my family or they find out or something like that? And then another doctor would be really far away. So the problem is
Mm.
elongating in a very different
Mhm.
manner. Yeah.
When we just want to be well, we just want to be healthy. That's the whole
Yes.
point. And it sometimes, and I feel like this comes up a lot on our show, it comes up a lot in conversations out there in the universe, is that
Mm-hmm.
healthcare systems or health insurance in general, like they they're not designed to actually keep you healthy. They're
Yes,
not designed in a
100%.
proactive manner. There was this big kind of, value-based care thing that started about 10, 11 years ago.
Mm-hmm.
And I was kind of in that space. It was like this very novel idea, like we're going to do healthcare different and we're going to design our health plans and the benefits for like steerage into our health systems that'll lower the cost down. It's going to create more proactive, what, I don't know, activity, right? From like on
Mm-hmm.
behalf of the plan member or the patient. And it hasn't really played out that way, quite honestly. It didn't really work the way that I think it was expected. And I'm like, well, that's because insurance, I don't care how much you put value-based care in insurance isn't designed that way. You have to change the entire system. You can't just change this one little part. But now where I'm seeing it happening is in tech. The value-based care is showing up in tech and apps and putting the control into our hands
The user's
as
hands. Yeah.
yeah,
Mm.
we are where the value-based care really shifts because now you're giving us the control. We don't sit there and wait for you to tell us what's wrong with us. We're going to walk into
Yes.
that office because we've been armed with the information. We have the technology. We've got we've got the blood
Mm-hmm.
test that we've already paid for because we're not jumping through hoops to get one. We're
You
just
got
going to go buy
and you
it.
got all your bio data from your
Yes.
wearables, and
Exactly.
you got all your, you got your Guava Health, so you have all your medical records all in one place, real easy access. And
Yeah.
like, that's what this podcast is really all about,
Yeah. So,
is being able to do that for yourself
yeah.
and be your own advocate,
That
and
is
and
the
really in a
shift.
way be your own doctor, which is a crazy thing to come out of anyone's mouth, but
That's
it's the
actually, yeah,
reality of
I
things now.
agree 100%. I think that's why I am so excited because usually as a doctor, you want people to come to you to know more information. But for me, it's
Uh-huh.
always great that they already have the information
Yep.
and they know what they're asking help for. You know,
Hmm.
it's they are not in the dilemma of, okay, I maybe or maybe not need help for this, but
Hmm.
they know, okay, I have this, I need help for this. And another thing I tell a lot of women is if you find one healthcare professional not helping you out, go and find another one. Like,
Hmm.
don't hesitate about it. Don't think twice. They are there to help you. It's not the other way around. So
Yep.
always find someone who can help you, make you feel comfortable, listens to you, and does not dismiss you. I think that's a
That's
And,
very
very
and
powerful.
important
us
thing.
women, we talk, so you'll find out. Just ask your friends.
Yes.
Yeah.
Yes.
And on that note, actually, so you have all these startups you've been involved with, and there's all these
Hmm.
women in all these places with all these different issues and angles on these issues. What would you like for, is there a general answer to this question? What's the best way for a woman to seek out the answers she needs? Like, is there a catch-all somewhere that they can, like, can they find you somewhere, or they have to like very specifically find the right app or find the right chat group on WhatsApp or whatever it is? But I'm just wondering, like, do you have advice for women on how to actually approach finding answers to their problems this way?
So, well, I wouldn't say I have the answer as yet, or at least a
It's
perfect
so
one.
complex. Like, I'm just
Yeah, it's
wondering,
not a
like, is there
perfect
a,
one. Yeah.
yeah,
But I think for over the years, what I've noticed is women know intuitively that something is not right.
Hmm.
And whenever she seeks, she finds the satisfaction in an answer that is complete, So it could be through a community, it could be through going to her doctor, it could be through maybe a Facebook group, WhatsApp group, an app she has downloaded, or whatever it is. I think at the end of it, she feels that, okay, my problem has been solved. And it's happened. I'll give an example. So there a couple of times I've worked in apps and I've answered questions, and I cannot, I would recommend a woman to go to a doctor if it's more serious. So there was a woman that actually came back to me, I think 2 years later or so, and I had not even working at the company anymore. And she told me, "Oh, I remember the previous time I had a concern during my first pregnancy, and you were there, and I talked to you." And she actually reached a solution. And she came back to me and told me that it helped her. So, that full circle moment where a woman, and obviously that I can tell you the story because I was a part of that full circle, but a woman can know it completely for herself that she has received the help that she needs because she's
Hmm.
feeling better, she's got the answer, she knows what she's supposed to do. So it's the all those after steps after asking the questions where you feel better, you know what to do, you're getting the help that you need. I think in that moment, that you have received the care that you need. Obviously, you'll have to search maybe for a little while.
Yeah.
If you're lucky, you'll find
Yeah.
it the first time. But I
I
think
think
all
that's the
women,
struggle.
It's a personal
yeah,
journey for
Right.
everyone
yeah,
involved. Yeah.
Yeah. Yeah.
yes.
There's no
But
one single pathway.
but now we have more options. I think that's the best part.
Yes.
We have more
That's true.
options, and yeah, we don't have to really wait for a doctor's appointment or go to another city. We have more options available at our fingertips to figure out like solutions to our problems.
Yeah. So
Yeah.
My follow-up question is I might feel like I'm stepping on Heather's toes maybe, but
you're
because
okay.
you usually do this. Well, that leads me to, so where specifically can they find you? Like, do
Me.
you have certain apps you want to I mean, this is where you get to, promote your stuff or whatever, or let people know, how to find
uh,
you or whatever. Are there
well,
certain
I have
apps that they should go to, or do you have a forum of your own somewhere?
I'm currently in a transitional phase myself. I have recently moved to Germany, so I am on the lookout for new opportunities here. I am
Oh,
consulting
okay.
with a couple of apps back home, but we are still in the initial processes, so I can't really. But I'm available on LinkedIn or anywhere to see what I'm new, what work I'm doing, and any conversations you want to have with me. I'm not very active on other social media as much.
Hmm.
So, but I do reply to messages on Instagram. So, definitely, if you find me there, you can do that as well.
Yeah.
Yeah,
I would
that's
encourage anyone listening to this episode, if you're interested in women's health, you're a great person to follow on LinkedIn. You have a lot of
thank
great,
you.
yeah, you got some good
Help steer people
insider.
the right way on
Yeah,
things.
it just the information you share out on your feed is really great. I've been following you since we connected. So all good stuff. And I maybe the message is you may not have a single app to say go
Yes,
check that one
right
out, but you're
now.
saying check out all the apps, right?
Well,
Like
Check out all the
find
apps,
all the
100%.
technology.
You
don't be
figured
afraid
that
to
out.
seek out your answers.
Yes,
Yeah.
Yeah, the
yes,
the problem is having a single source of truth that you can go to
yes.
and say, "Oh, these are all of my options that exist out in the world." So, I think
Yeah,
maybe
I
if
agree with that. I
yeah,
always am a huge
that's what we
supporter
need.
of that. I mean, like, go out there, figure it out, and you can always find me. I'm here always
Yeah.
to answer anything. And I
I,
think
I will put
it's,
your LinkedIn in the show notes
Yeah.
oh, thank you. Yeah.
for anyone
I
who
think
wants
being
to
a
click
part
on
of
it.
the ecosystem is the best part. You
It
find
is.
something that you're looking for
It's
once you're
a
in there.
it's
Yeah.
a great ecosystem to be a part
Yeah.
of. I
Yeah.
love it. I love that I get to meet people like you and all these
Mm-hmm.
other startup founders that are just,
Doing amazing things.
And my producer brain is already going, well, when you finish your apps, come back on and talk about your new app
Oh,
Yeah,
that would be great.
because we
I'd
love
love to
having
do
people
that.
back on the podcast.
we do. We do. Yeah,
Yeah,
actually
I'd
it's
love to do that.
I would like to bring Svetlana back from Strawberry Health because it was January. I want to say actually we published
She
in January, but we
she was
recorded
I can tell you
almost a
she
year ago.
she was episode 2, so that would have been January 20th.
He's strangely knows these details, but now it's like a great time to bring her back
Oh no, I'm
because
sorry, January 19th.
okay,
Yeah, 19th.
because there's so much that has happened in a year for
Yes.
them, right? And that's kind of the cool thing about the startup space. I have a full-time job too, and I work for a startup in healthcare.
Oh,
And so
interesting. Yeah.
not only do I do this podcast, but I work in that space. And I mean, in startup life, like things change within a month, right? Like
That's true. That's
you can
true.
just pivot, very quickly. And I came from the insurance side. So I've gone from like the big behemoth, like making a
Mm-hmm.
change is turning the Titanic, um, to, hey, this isn't working. And we're like, all right, cool. Let's try something else next week. So,
Yeah.
yeah.
Yes.
And we got Jessica Tracy from episode 1 coming on in our next
Yep.
episode, I believe.
Yeah, yeah, we're bringing them all back. So, anyway, well, Michelle, I love this. This has been a great conversation. I think just to talk kind of more broadly about women's health and kind of the
Yes.
innovation and the growth and all the good stuff that's
Mm-hmm.
coming. And women, listen, there is something out there for you,
There are
literally.
answers. You just have to look for them.
You just have to look
Yes,
and don't be afraid to
Have to
ask.
look for
I
them.
think that's another thing I would tell every woman is don't be afraid to ask. Like
right.
there are people out there waiting to help you, want to help you, are building things to help you. So just go and ask any question that you have, search for the answers, and you should hopefully find it.
You can find a lot of them right here on this podcast.
Oh, yes, that's
That's
true.
also very true. Yes.
We're your source of truth. Well,
Well,
we'll make that happen. Well, thank you so much for coming on. This has been a really great conversation. And I'm so glad that we met.
Likewise. Yeah.
So, yeah.
Thank you for inviting me. I also had a great time, and it's a perfect way to end my day also.
thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube and Patreon, patreon.com/healthcareuprising, if you want to watch us in action.
You can also find us on social media on LinkedIn, Blue Sky, Instagram, and Facebook. Just search Healthcare Uprising to find us. And if you're a new company or a creator with a cool new product for the healthcare space, or if you're someone with a personal healthcare journey and you'd like to share it with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. That's all for this dose of Healthcare Uprising. Till the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.